Good morning, or good afternoon, depending on where you are, what time zone you're in. My name's Kira. I'm the GCR Resident Partners Chair. So thank you all for joining on our webinar today. Kind of some three main things we're going to hit today. I'm going to start by letting Dr. John Peterson, who is a resident at Moffitt, recently had an experience with the CRDF Global in Ghana. And so he's going to kind of tell us about his experience, a little bit of an example of kind of things you can do, opportunities we have as residents. And it's just kind of getting your foot in the door and kind of what he learned in the collaboration that they're creating. So I'll let him talk for a little bit. And then I'm going to have Reverend Dr. Kofi speak next because he was there as well. And so they're going to both kind of talk about their experiences, their perspective from this event. And then we have a special guest joining us. Her name is Ruth Cooper, and she is here representing eCancer, which is a virtual education platform. So she's going to talk a little bit about that and opportunities to get involved if you'd like to on the resident side for some of these more integrative educational opportunities. So she'll be, I think she's just joined us, so she'll be giving a little blurb about that towards the end. So with that, I'm going to let John get started.
And as you said, good morning to those in the Western Hemisphere. Good afternoon to those in the Eastern Hemisphere. We're so glad that you're here. I'm John Peterson. Dr. Kofi Kyei is also with us. I myself am a resident. Dr. Kyei has been practicing for a number of years, and we're going to offer two kind of experiences and takeaway perspectives that we've had from the CRDF Global Conference that was held in Ghana back in July. It was a rich experience, especially for me. It's my first time in the African continent. I was so grateful to get involved and to learn from the global leaders who were there at the conference. I'm going to first offer kind of my resident perspective, and then Dr. Kyei will share the local perspective as well. So to give you a little bit of background, while we were there, we were able to visit the Korle-Bu Teaching Hospital, which is part of the University of Ghana, which is public. Also the Sweden-Ghana Medical Center, which I might refer to as SGMC. It's a private hospital also in the Accra area. And then, of course, there was the workshop series focused on expanding access to radiotherapy in West Africa. Here at the bottom, you can see the reception area for the SGMC, and then here on the right, the photo of us touring the campus at Korle-Bu. So to give you a little bit of background, kind of what we were seeing there, we were able to tour the radiotherapy department as well as diagnostic radiology and pathology. You can see one of the LINACs at Korle-Bu, and we were able to learn a lot from folks like Michael here, who's a medical physicist at Korle-Bu. And then, of course, we were at SGMC as well to see their facilities, the equipment that they have, including their linear accelerator, their open bore MRI, the CT Sim suite, as well as their operating rooms. And again, getting a picture of what the private cancer care context is in Ghana. So just to kind of give those of you who were there some background of kind of the staffing and equipment situation. Korle-Bu has 12 radiation oncology residents who are also trained and administer care in medical oncology, as well as 12 attendings in radiation oncology, 4 medical physics residents, 4 medical physicists who are also performing the role of dosimetry in addition to quality assurance and quality control techs, 12 radiation therapists, and a variant-trained engineer. For their equipment, they've got a LINAC, a Cobalt-60 teletherapy machine. They also provide HDR brachytherapy. They've got their 2 CT scanners, a SPECT CT, their fluoroscopy machines, and then they're using Eclipse and Prowess for their treatment planning. They also have a PACE data server that goes back about 3 years, storing the PACE care data. And now at SDMC, they have a linear accelerator. They also provide brachytherapy. They've got an MRI and a CT scanner. And their staff is smaller, but they're also training medical physicists and radiation oncologists as well. So I'm going to kind of speak a little bit about the staffing challenges and as well as the equipment challenges. These were challenges that were brought up to us by the radiation oncologists, medical physicists, and others that are working in this field in Ghana. And to kind of introduce this topic, I just want to share a brief story that I had in speaking with Dr. Eric Addison, who has a background in medical physics, now working with the Ghana Society for Medical Physics. He's been in the game for a long time in Ghana, has been able to see changes in the field of the maturation of the field as it's grown. And I was curious just to kind of get his perspective, since from kind of my background in the United States, radiation oncology is a niche field. Sometimes in our case, not as many people are applying into it as before. And I was curious if there have been similar challenges recruiting folks coming into medical physics and radiation oncology. And what he shared with me is that over the years, he's actually seen more folks interested in going into radiation oncology, more kind of recruits coming in both medical physics and radiation oncology. And however, the challenge has been retention, that much of that workforce has either moved out of the country, out of the continent, and out of the public sector as well. Some folks who used to be at Koibu going to SCMC often wooed away by higher salaries and more equipment, which has been a challenge for sure. And this is leaving a very high patient to doctor ratio. And to put numbers to that, the doctors at the Koibu Hospital are seeing an average of 100 patients a day in consults and in treatment visits. Now, there are also equipment challenges. This was, again, a prominent challenge that was brought up in our conversations with folks on the ground. Now, unfortunately, purchases of equipment often happen without consulting the Koibu staff. And decisions about what equipment will come to their hospital is often made by the donor countries without as much input by folks on the ground. And while they do have a variant trained engineer, there's only one variant agent in all of Ghana, which complicates equipment repairs. Since if a machine breaks down and perhaps a part that's not available in the country, or a mechanical failure that requires maybe a higher level of expertise, if that occurs, they have to wait until that part is shipped or until somebody out of the country comes in to address that repair. And that entire time, the machine is out of commission and nobody is getting treatment. Another difficult challenge is, purchasing other supplies. Although there is universal healthcare in Ghana, the scope of what is compensated is fairly limited to basic medical care. And the care required to do cancer treatment does not fall within that scope. And so each department, including the pathology department, when they need to buy the chemicals and to do their assays and their immunohistochemistry, they are purchasing that themselves. Repairs and equipment purchases, each department, to put it the way the department chair of pathology at Koibu put it, each department is working as its own business, which again is a challenging thing to not have that support. To give you context, there's a $50,000 annual service fee per machine. And these machines break down on average about 3 years after they've been received. So again, repair and downtime is a major challenge. So this kind of leads to my first takeaway, is that in Ghana, just like in each of our countries, there's a large cancer burden, a lot of folks who need care. And unfortunately, that is out of proportion to the human technological resources, the experts and specialists who can provide that care, and the equipment and machines that they need to administer that care. It's a significant burden. And we already spoke about how many patients these physicians are seeing every day. And making things even more complicated, making it even more difficult to kind of lift up and carry that responsibility are the costs. That kind of rusty axle there at the fulcrum of the seesaw, just adding a little bit more friction and more obstacles to get more human resources in the form of hiring. These specialists need to be hired. They need to have good salaries. And then, of course, to purchase the expensive equipment and to maintain it year after year. So what can we do? This can feel overwhelming because these are big challenges, and we're only speaking about Ghana. There are challenges in each one of our countries. Well, fortunately, we were able to find we encountered a great deal of interest and enthusiasm among the trainees that we met with. I had the privilege of being able to present to the Department of Radiation Oncology at Korle-Bu and speak with residents and share with them information about GCR Resident Partners. And we got a lot of interest. 22 trainees shared their information with us. Hopefully some of you are here on this call today, 18 from Korle-Bu, 4 from SDMC. And when we did a kind of an unscientific survey asking folks what the challenges are, again, more equipment, more specialists, retaining the specialists that they have, these highly skilled individuals, their skills are so important. And I'm going to kind of use the metaphor to speak about that in just a moment. And additionally, in conversations, there were a lot of trainees who expressed an interest in research partnerships and educational exchanges to learn from what folks are doing in their region, perhaps outside of their country, and in other regions throughout the world. So to kind of use a metaphor of kind of another perspective, kind of a takeaway that I had is I want to use the metaphor of the Thai football team. I don't know if many of you folks remember this story. It was in the news a number of years ago, but there was a soccer or a football team, depending on what part of the world you're coming from. In Thailand, they went together to go explore a cave, and unfortunately, monsoon season came in earlier. The cave flooded, and they were trapped. It was a long, convoluted, narrow passage, and difficult to access them. And a complex, highly integrated rescue effort began. Now, to rescue and save the lives of these kids required a niche, highly specific, and highly trained level kind of expertise. Cave divers. There aren't a lot of cave divers in the world. There aren't a lot of expert cave divers in the world. But in this moment, in order to save lives, those were the skills that were needed. And these folks were in many countries throughout the world. Now, fortunately, because of the internet, because of email, because of the network, the community of cave divers, they were able to reach out to one another, come together, working with the Thai Navy. There were also some support from the American military and from other groups in the community. They were able to come together, to collaborate, to draw upon not only the skills that they had in common, but the diverse experiences that they each had to figure out a solution to save the lives of this soccer team and bring them out. And it was just a remarkable rescue effort. Everyone each one of the kids was saved. And just as an example of the unique expertise, one of them had a background in anesthesiology and was able to draw upon his experience to figure out a way to safely sedate the soccer players so that they were able to make the exit, guided, of course, by the divers on their way out. Now, radiation oncology is similar in that we're a niche field. There aren't that many of us, and a lot of folks. Sometimes a joke. People don't exactly know what we do. Perhaps they think we're a diagnostic radiologist. Radiation itself is, poorly understood and feared in many parts of the world, and understandably so because of the negative ways that it's been used in the past. But at the same time, our skills are needed. Radiotherapy saves lives. It prolongs life. And even in the cases where cancer is terminal, it effectively relieves symptoms. Our skills are needed. There aren't that many of us, perhaps, but just like those cave divers, we can, I believe, connect with one another, to network, to draw upon our diverse experiences and our common skills and training to save lives and to address challenges throughout the world. And that's why I've included these photos here, just to see the faces. Perhaps some of you know some of these individuals, but we've got folks from government and non-governmental organizations like the IAEA, the African Atomic Energy Agency. We've got physicists, we've got dosimetrists, we've got radiation oncologists. there's a big community, and I really believe we have an opportunity, as it's in our name, a global coalition of folks with a background in radiotherapy to collaborate and to improve the lives and to save the lives of cancer patients throughout the world, and to take down these barriers to care. Again, this is a group photo that we took at the conference. We've got folks from multiple continents, many countries, many backgrounds, all united in their passion for radiotherapy and their understanding of the potential it has to provide relief to cancer patients. Now, perhaps how can we do that? Well, hopefully I can set up Ruth with eCancer, but we have not only a broad community, but we have online resources. Perhaps we can continue to provide education and training with certifications to recognize those who are contributing to the body of knowledge. We can advocate with culturally specific education to dispel misunderstandings about cancer treatment, about radiation. And we can network, again, supporting one another so that we can really build a strong community and improve access to radiation. Of course, this was in the context of West Africa, but it is indeed relevant to whatever region of the world you might be in. And so thank you for your time. I'm going to turn it now over to Dr. Kyei.
So glad to see you in Ghana. We had a very wonderful time, and truly appreciate the opportunity that the Global Coalition for Radiotherapy gave us to represent them. It was really insightful from the local perspective because there were lots of things that we can come in. Just some few days ago, I even had a mail from one of our oncologists who is bringing an issue that Sudan are facing. And I discussed with John that we should even bring it to the Global Coalition for Radiotherapy. So I think that our impact are being felt all over Ghana here in Africa. And there were some few local perspective issues that I want to bring to bear. Next slide, please. So what we were looking at is that on our setting, education and should be key, previous slide, yeah. So education from our side, I think the Global Coalition for Radiotherapy can help with education. And if we are able to situate ourselves, to educate, of course, in several various forms of education. I'm sure we are doing quite a lot now, but if we transcend that, to the medical imaging across, all health, practitioners within the African setting, particularly with cancer prevention, education on screening, diagnosis, it will interest you to know that so many of our patients come to the hospital and they don't know anything about their diagnosis. And sometimes they will just tell you that you just go ahead and do whatever you want to do for me. I just want to get well. I'm not, so worried about what is happening to me or not. And sometimes even the side effects, when you want to talk to them about the side effect of the treatment, they are not even interested in it. So I think there should be some more education on particularly the cancer prevention, the diagnosis, and the treatment trajectory, as a whole, from radiotherapy all the way to hormonal therapy. I think GCR can situate itself in that. And it's one thing that I wish we can do more. I know we're doing, so much. There is also the education in terms of the social support for cancer patients, which of course I know you're doing massive. But within our setting, I think that if we are able to champion the education in terms of assisting patients on the social level, and then their respective families, I think we would do much, good to them. The next thing that I also saw, myself and John, we went through the hospitals after we went to the conference, we went to the private hospital. There was one thing that, was prevailing, and that was the training of the practitioners. We saw that, yes, in Ghana, we do train oncologists, we do train therapists, we do train physicists, but what we are looking at is that the people we are training, they are leaving the country. So all the people we train, particularly last year and this year, about 50% of them have left. And that is a huge blow to the country, Africa and Ghana and Africa at large. So what can GCR do, to help with the training of our professionals within the various relevant medical disciplines for cancer care in Africa? So it was one thing that was very sounding, There was also something that we discussed, and when we were at the meeting, myself and John, we decided to, when there were divisions of grouping, we decided to go to different groups so that we can have a holistic, so I went to one group and then John went to another group. Interestingly, the group that I went, they made me the project lead of that group to assist, and I'm sure, Darian, you were part of the meeting we had yesterday at the Ghana UGSR, meeting, which I presented. And that was because GCR gave me the opportunity to attend, so even that I was selected to lead the technical assistance and then issues that relate to the radiation oncology setting in Ghana and then cut across West Africa. And that was a big thing that GCR can do. So if I am there, I am not there for them because I didn't go because of them. It was because of GCR. So my presentation there will be for GCR. And what they are looking for is technical assistance. How can we, as GCR, help explore opportunities for technical assistance, particularly, linking with IAEA, WHO, to be able to help increase access to cancer care. Now, it's surprising and sad to note that, many more of the West African countries come to Ghana for cancer treatment. And look at the machines that myself and John saw. There are only 3 centers in Ghana, 2 government and 1 private, and that is serving the whole country plus most of the West Africa countries. So is there a way that GCR can help, explore opportunities? Of course, we lead and we champion this, for some level of technical assistance through IAEA and through WHO. I know that it's something that we can also do to help with what is happening. The other thing that, we were also looking at was expanding our social support for patients. For example, patient navigation. And myself and John, we spoke about, patient navigation and then transportation and then lodging. It will interest you to know that, most of the patients, because of transportation and even accommodation, they don't come for treatment because they are staying far away, like 2-3 hours drive. Sometimes they want to come and stay in the hospital and have their treatment. They don't have the money. And cancer care in Ghana is pay out of pocket. If you don't have the money, you cannot receive treatment. And that is what is on the ground. So we were thinking at large to see how, GCR can, situate itself, to, get, explore for opportunities for these assistance, particularly through the International Atomic Energy Agency and then the WHO and any other organizations. We also wanted, to see how GCR can expand opportunities opportunity and share some practices for public-private partnership. Yes, we saw that in Ghana and Africa, some of the African member states that were at the conference spoke about public-private partnership, where the same faculty, the same practitioners can switch between the private and the public, because the numbers are few. The few are also leaving. So the very few that are left, is there a way we can champion that to help expand several opportunities, particularly models of negotiations and contracts, and then organizing what we call ethical refreshers for practitioners, which I know GCR is already doing it, such that we include more of the members that we got from our setting. If you look at the numbers that joined, most of them are from Ghana. And what we want to do is to see if we can expand it to Africa, moving from West Africa and then to Africa, getting all the residents, getting all the, physicists, getting all the radiation oncologists, medical oncologists to be on board, so that we can champion the same cause. Finally, I also discussed with John that what do we want to do? How can GCR situate itself? So what we said is that, one, front education and capacity building. That should be one of our focus in Africa. If we educate the people and you don't even give them money, you've done about 90% of the work. How can we get funding to help with mobilization of practitioners within the sub-region? How can we assist and lead the support of mobilization for African member states through the agencies that we've mentioned? Then there should be more dialogue with stakeholders within this part of the continent. If we situate, there are more of the Europeans than Africa. So is there a way we could get more of the dialogue with some of the stakeholders within the Africa, like the Ministry of Health that we spoke to yesterday, and so many of the agencies, with these initiatives, if we are able to fund this, I'm sure GCR, we can situate ourselves within the continent and be a prime focus where everybody will look, when it comes to this. So these are some of the things myself and John. Of course, we had fun as well. We went to the market. Myself and John were at the market. We bought some chocolates and some traditional wear. It was fun in Ghana, and I'm so glad I represented GCR for this conference. Thank you. I don't know whether John will add anything before we switch over.
Only that Ghanaian cuisine is some of the most delicious I've ever had.
Yeah, thank you. I appreciate you guys coming and talking and sharing your experience with all of us, because I think that's been, that helps us see kind of firsthand what can be done and what we can do, and kind of that sort of perspective is, I think, invaluable. So I really appreciate you guys presenting. All right, so next up, I'm going to have Ruth Cooper from eCancer talk a little bit about that initiative. And, as John already mentioned, that's kind of something that we can certainly help out with, and poses a very good opportunity, especially for residents. So I will leave it to Ruth.
Hello, everybody. First of all, I just want to say I'm sorry because my camera, for some reason, is not connecting. But I hope you can all hear me okay. I suppose that's the most important thing. It's so nice to hear from everybody so far. It's really nice to hear such lovely things about eCancer as well. So thank you for that. But I guess I'll just speak a little bit about what we do first of all, and a bit about us. So I'm Ruth. Ruth, I work for eCancer. I handle the funding and coordination of all our projects, really. We're a UK-based charity in the sort of south of England, and as it's kind of been mentioned, we're an education charity for oncologists and healthcare professionals on a global scale, but sort of primarily low and middle income countries. So we are all about removing, financial, geographical barriers that healthcare professionals in these regions might face to knowledge and, discoveries and cancer care developments, I suppose. And we just want to ensure that patients are receiving the best care, regardless of the circumstances that they might find themselves in. So we have our journal. There's a number of ways in which we do this. We have our journal, which is totally open access, and we run a pay what you can afford model, meaning that authors from and researchers from low middle income countries are able to publish their vital research that they ordinarily probably might not be able to. And we have our special issues that cover a number of special issues on a yearly basis. We've got our e-learning platform, which is CME accredited. We're accredited by the EACCME. And we have hundreds of e-learning modules available on sort of all cancer care topics that you could kind of really want. And they're all totally open access, multiple languages, which we track and ensure that people are being kept up to date in that way. And then the other main thing we sort of do are our events. So they're all over the world. We travel to locations all over, training and having speakers and doing sort of expert panel discussions. We work quite a lot with Choosing Wisely, club with them, and I think that sort of leads on quite nicely to what we want to do with you guys, hopefully, in terms of radiotherapy, because as it's kind of meant, I would sort of repeat, but it's vital equipment, and the challenges that are faced in the staffing areas and the equipment is sad, really, and it's vital pieces of equipment, as I've said, and it's well worth the weight of gold in terms of expense and specialist training and maintenance and all that side of it. So we're really, really keen on creating a collaboration and providing healthcare professionals in these remote regions that don't have access to it to ensure that they can treat patients in the best possible way and receive the best possible care that they can. So we want to ideally provide our education on this in the travel locations that we have planned over the rest of 2023 and into 2024. So, we've got our next sort of events are in India in September. We've got a couple in India. We've got Kolkata and Mumbai, Nepal, Colombia, and then moving into 2024, we've got India again. I believe it's Delhi and Bangalore there. And then Rwanda and a couple more that might be confirmed quite soon. And we really would like to develop 3, ideally, e-learning courses that would then be put onto our website, which, as I mentioned, is completely open access, free. Anyone that wants to use it can, and improve their clinical practice or just learn about patient-centered approaches. And we want to have, I think, about 50 videos, hopefully, in multiple languages. I know that might be a bit ambitious, but that's what we're here for. And whether that would be interviews, expert panel discussions, but we want to cover practical advice based on the specific educational needs of each region. It's really important, as sort of echoing what John was saying, that it's not just a general educational approach. We really try to be on the ground in the places that we travel to ascertain what they need and what we can give them, so that it's ensuring that because every patient is different, and that's in the north, global north. So in these circumstances in countries that have such different resources available to them, it's so important that we are actually being helpful in the way that they need and not in the way that we think they need. So that's kind of our goal. That's what we want to be doing, and collabs with people like GCR and other partners is as the only way that we can do it, really. I mean, I say we are a charity and we all work extremely hard, and as you guys too, and it is that people, and we're so lucky that we have such a great network of people that we really work hard to expand and maintain to ensure that we are constantly growing and helping as many healthcare professionals in the oncology field as we can.
Well, thank you, Ruth. That was very helpful for my understanding, and I think for everyone. And thank you for all the work that you guys have been doing, because that's incredible. And I love the idea of, very, a worldwide, platform that is, and allowed to, help multiple people in multiple different countries, but it is specific to those regions, and, it is attuned to issues and concerns and the needs of those areas. So I think that's incredible work you're doing. So thank you for sharing. And I think, we have a lot of residents who are not on this call, but that's why we're recording it. And I think certainly there will be some interest, and we'd be happy to help as much as we can. I personally am a big advocate for education and things like that. So I guess one question I have for you is, as far as funding for eCancer, since you provide the educational programs for free, kind of is a lot of like volunteer work happening to make these like educational modules?
Yes. So at our events, it tends to be that all the speakers and everybody that we collate at different events that are able to be there and speak for us is, their time, and it's volunteered their time. So on that level, yes, but we apply for various grants, funding from a number of different avenues, and that sort of covers the cost for putting on our events. And we're quite lucky because we have our own video team within eCancer, so we have our own team to film all of our events and webcast that onto our website. So yeah, that's kind of how we manage to carry on.
Just to clarify, these events are in-person events?
Yes. Yeah. So all of our events are in person. Yeah. Depending on where and what area we're covering, the numbers can vary, but it can be, anywhere from like 50 to like sort of 700 over like a big project. But what we do like to do is, obviously, we ensure that we film absolutely everything that we do, so that it isn't just the people at the events that the knowledge is restricted to. It is, passed on to those in other regions that might be able to find it helpful, because, knowledge is power, and although it's specified to that specific region, it's you never know what you're going to pick up, essentially.
I can just ask a quick question, Ruth. I think you mentioned 3 courses that you were trying to create. Do you have the topics for those 3 courses?
Yes, so we do, but we would like ideally more input, and would really welcome that in terms of radiotherapy. 100%, yeah.
Ruth, clarify for me if I'm wrong, but when I was speaking to Danny about this, it seemed that that's where he wanted the GCR and potentially the GCR residents to come in, like helping structure what those courses will be like. And then in terms of like having the regional support of finding the people who will help do the courses, help teach them on the ground. Is that correct?
Yes, absolutely. Yeah, you've put it absolutely perfectly yourself. We welcome, as I said, as much structure and knowledge surrounding this topic as we can get.
Thank you again for everyone for joining. I think it's always challenging coordinating time zones since we are in multiple different continents. So I really appreciate everyone taking the time out of their day to join us. And again, to our presenters for a wonderful presentation and helping us understand these initiatives and the need globally and where we can be of greater help. So once again, any questions, email me and we'll get you to the right place. So with that, thank you. You guys, everyone have a great rest of the day, however much day you have left. So